Hi everyone, and welcome to part 3 of our RCM case study. Today we're going to explore failure consequences and preventive maintenance. Let's dive right in. As previously mentioned, the first 4 steps of the RCM process make up the FMEA, or the failure modes and effects analysis. In step 5 of the RCM process, we assess consequences for each failure mode. Steps 1 through 5 of the RCM process make up the FMECA, or the failure modes, effects, and criticality analysis. Let's learn about failure consequences. A failure consequence identifies how a failure mode or a multiple failure matters. In other words, a failure consequence indicates the significance of the failure effect. There are 4 kinds of failure consequences: safety, environmental, operational, and non-operational. Recall from yesterday's video, we said that failure effects should be written in enough detail so failure consequences can be assessed. Remember from yesterday that we wrote the failure effect for failure mode 1A1, bacteria that leads to cavities accumulates between teeth due to normal use. We identified that the worst case that could happen if nothing were done to manage this failure mode is that the patient could die because the infection could become fatal. Obviously, this has safety consequences. We're able to quickly establish that because we did a great job writing our failure effect. Let's take a look at the framework of an RCM decision diagram. We use the RCM decision diagram to assess failure consequences. When we do RCM, we analyze one failure mode at a time. So we refer to our FMEA and start with the first one: bacteria that leads to cavities between the teeth due to normal use. In the first question, we establish if the failure mode is evident or hidden. How we do that is outside the scope of this video. This failure mode is evident, so we move to the left on the RCM decision diagram and we start assessing consequences. Recall that by writing the failure effect, we said that worst case, the patient could die if the failure mode was left unmanaged. So we answer yes to safety and we move down this column on the RCM decision diagram. Note that once we assess consequences, we establish which column on the RCM decision diagram we'll use, and the rest of the decision diagram is eliminated for analyzing this failure mode. Notice how there is a hierarchy to proactive maintenance on the RCM decision diagram. We have condition-based maintenance and preventive maintenance to consider. For this failure mode, CBM is not an option. Stay tuned tomorrow and I'll show you why. For now, let's focus on considering preventive maintenance for this failure mode, specifically a scheduled restoration. But before we do, let's have a brief tutorial and then we'll apply that knowledge to our case study. In the context of reliability-centered maintenance, proactive maintenance includes preventive maintenance and condition-based maintenance. Preventive maintenance includes scheduled restoration and scheduled replacement tasks. A scheduled restoration task reworks or restores an item's failure resistance to an acceptable level without considering the item's condition at the time of the task. A scheduled restoration is also known as a scheduled overhaul. Let's focus on a phrase in the definition: without considering the item's condition at the time of the task. The thing about scheduled restorations is that you perform them on a fixed interval basis regardless of the item's condition. In other words, you go in and do the task without any kind of inspection first. You don't check to see if it needs it before you do it. An example could be recycling a vehicle's engine coolant every 100,000 miles, or cleaning the cooling tower filter every shift. Note here that the coolant is going to get recycled every 100,000 miles no matter what, and the cooling tower filter is getting cleaned every shift, regardless of its condition at the time. Let's move on and talk about scheduled replacement tasks. A scheduled replacement task replaces an item without considering the item's condition at the time of the task. Again, let's focus on the same phrase in the definition: without considering the item's condition at the time of the task. Just like scheduled restorations, you perform them on a fixed interval basis regardless of the item's condition. In other words, you go in and replace the item without any kind of inspection first. An example could be replace the engine oil every 5,000 miles and replace the transmission filter every 5 years. These tasks are accomplished on a scheduled basis without taking the condition of the item into account. Scheduled restoration and scheduled replacement tasks are called preventive maintenance tasks because action is taken before failure is allowed to occur, thereby preventing failure. In the context of RCM, for any proactive maintenance task to be assigned, it must satisfy both of the following criteria. The task must be technically feasible and worth doing. With respect to scheduled restoration and replacement tasks, let's start with what makes them technically feasible. One of the most important elements that makes a scheduled restoration or a scheduled replacement task technically feasible is that the likelihood of failure increases with operating age. In other words, there's a useful life. What do I mean by useful life? If an item has a useful life, it means that there is an age at which there's a rapid increase in the conditional probability of failure. Let's take a look at the failure pattern that depicts this, and let's break it down so it's easy to understand. The x-axis is age, which can be expressed in any number of units, such as days, weeks, months, years, miles, cycles, operating hours, takeoffs and landings, etc. The y-axis is the conditional probability of failure. On this failure pattern, you can see that the probability of failure as age increases is constant in this region until it reaches this particular age. And then the probability of failure starts to drastically increase. As a result, we restore or replace regardless of the condition at the time. Let's see how this applies to our case study, and let's analyze failure mode 1A1. Bacteria that leads to cavities accumulates between the teeth due to normal use. We'll focus on the scheduled restoration box on the RCM Decision Diagram. Here are the questions that appear in that box. Let's answer the first one. Is there an age at which there is a rapid increase in the conditional probability of failure? Well, let's refer back to our failure effect. Remember we said that within 24 hours the bacteria starts to break down the tooth's protective enamel? And if the bacteria is left undisturbed by not flossing, over a period of months, the decay progresses? So yes, there is an age at which there is a rapid increase in the conditional probability of failure. What is that age? It's 24 hours. That is the useful life. We have already established in our failure effect that if we don't disturb the bacteria, in other words, if we don't floss our teeth before 24 hours are up, the conditional probability of failure starts to drastically increase. In our example, that means that decay progresses. Do all failures happen after this age? According to our dentist, yes. Does the restoration task, that is flossing daily, restore the original resistance to failure? Yes. By flossing, we disturb the bacteria so it doesn't have a chance to start the decay process. By answering these questions in the affirmative, we have established that flossing our teeth every 24 hours is a technically feasible task. Now we have to decide if it's worth doing. Does the task reduce the risk of failure to an acceptable level? Yes, it does. So we have established that our restoration task, to floss between all of our teeth daily, is both technically feasible and worth doing. So we assign that preventive maintenance task. Let's take a look at failure mode 1A3. The failure mode is plaque and tartar build up on hard to reach areas, gum line in between teeth unreachable by the patient due to normal use. Here is the failure effect. Over time, plaque around the gum line in between the teeth hardens and turns into tartar. After about 6 months, the buildup starts to irritate the gums. Over a period of a year or so, the gums are likely to start to recede. This exposes the roots of the teeth, which start to weaken structural support and can lead to potential tooth loss. The patient may begin to experience sensitivity to hot and cold foods. Eating and drinking may be uncomfortable. If these symptoms are unnoticed or ignored, over time it leads to the early stages of gum disease and starts to compromise the structural integrity and health of the teeth overall. The excessive tartar harbors bacteria that eventually starts to break down the tooth's protective enamel. The patient is likely to experience halitosis. The gums are likely to bleed and cause the patient discomfort. Chewing efficiency declines and speech may be affected. If these symptoms are ignored, worst case, the bacteria causes tooth decay. See failure mode 1A1. Let's analyze this failure mode using the RCM Decision Diagram. Again, we'll focus on the scheduled restoration box on the RCM Decision Diagram. Is there an age at which there is a rapid increase in the conditional probability of failure? Yes. What is it? We said after 6 months, the buildup of plaque and tartar start to irritate the gums. So the age is 6 months. That's the useful life. Do all failures happen after this age? According to our dentist, yes. Does the restoration task, that is a professional teeth cleaning, restore the original resistance to failure? Yes. By having our teeth cleaned, we have the plaque and tartar professionally removed. Now we have to decide if it's worth doing. Does the task reduce the risk of failure to an acceptable level? Yes, it does. So we have established that our restoration task to have our teeth professionally cleaned every 6 months is both technically feasible and worth doing. So we assign that preventive maintenance task. This is how preventive maintenance tasks and their intervals are properly established. But let's make a couple of important points. Preventive maintenance task intervals are not based on mean time between failure, or MTBF. MTBF is an average, and preventive maintenance task intervals are not based on criticality. Preventive maintenance task intervals are based on the useful life. Be sure to join me tomorrow for part 4 of our RCM case study. Tomorrow, we're going to explore condition-based maintenance. You don't want to miss this one because you won't want to make the same mistake that a lot of organizations are making when it comes to CBM. I'm Nancy Regan. Thank you for watching.